Did you know that mistaking Medicaid for Medicare could cost you thousands in healthcare bills? Or worse, leave you uninsured when you need it most? Navigating healthcare options as you approach 65 can feel like deciphering a secret code. And two terms that constantly cause confusion are Medicaid and Medicare. Many believe they're interchangeable, but they are fundamentally different programs with distinct purposes and eligibility requirements. By the end of this video, you'll have absolute clarity on the key distinctions between Medicaid and Medicare, empowering you to make informed decisions, avoid costly enrollment mistakes, and confidently secure the healthcare coverage you deserve. You'll gain peace of mind knowing exactly which program applies to your situation. I'm your guide from Medicare 65 Made Easy, your go-to resource for simplifying Medicare and making your healthcare journey stress-free. One of the most common and damaging mistakes we see seniors make is confusing the terms Medicaid and Medicare. They sound similar, but their differences are monumental. This confusion often leads to people missing crucial Medicare enrollment periods, especially their initial enrollment period, IEP, around their 65th birthday. Imagine waiting until you're already 65, realizing you've confused the programs, and then discovering you're hit with lifelong late enrollment penalties for Medicare Part B simply because you didn't understand the distinct nature of each. This isn't just a minor oversight. It can result in a significant permanent increase in your Medicare premiums, impacting your retirement budget for good. We often hear stories of individuals assuming they're covered by something like Medicare, only to find out too late that what they had was Medicaid, which offers different benefits and isn't a substitute for Medicare as they turn 65. Another major pain point is the uncertainty about which program is actually relevant to your specific financial situation. Many seniors believe that if they have a limited income, they automatically qualify for Medicare. However, Medicare is primarily an age-based and disability-based health insurance program, while Medicaid is a needs-based program designed for low-income individuals and families. This leads to immense frustration when people find out their income is too high for Medicaid, but they're still struggling to afford Medicare premiums or out-of-pocket costs. The worry about how to pay for healthcare at 65 is constant. Understanding the financial eligibility differences for Medicare eligibility versus Medicaid eligibility is paramount to avoiding this financial stress and ensuring you're looking into the correct avenues for assistance, whether it's Medicaid for seniors or Medicare financial assistance programs. Perhaps the deepest fear is the possibility of being uninsured or having inadequate healthcare coverage when a serious health issue arises. The complexity surrounding Original Medicare, Medicare Advantage, and Medigap is daunting enough. But when you add the confusion of Medicaid benefits into the mix, it becomes paralyzing. People worry, will my doctors accept this coverage? Or will I be able to afford my medications? This often stems from a lack of clarity on whether Medicaid can supplement Medicare, or if they are entirely separate entities. The thought of falling through the cracks or discovering you don't have coverage for a critical procedure because you misunderstood Medicare versus Medicaid coverage is a terrifying prospect. This fear often leads to delaying crucial health decisions or feeling completely overwhelmed by the healthcare system, especially when looking up Medicare for seniors or Medicaid qualification for elderly. Let's shatter the confusion immediately. Medicare is a federal health insurance program primarily for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease, ESRD. Think of it as your primary health insurance as you age or if you have specific qualifying conditions. It's not tied to your income level, though some low-income individuals may qualify for assistance with Medicare costs. The key here is age or disability. When you turn 65, regardless of your income, you become eligible for Medicare. Your Medicare initial enrollment period is crucial. It's a 7-month window around your 65th birthday, starting 3 months before, including the month of, and ending 3 months after. Missing this window, particularly for Medicare Part B, can lead to permanent penalties. Remember, Medicare enrollment is time-sensitive. In contrast, Medicaid is a joint federal and state program that helps cover medical costs for people with limited income and resources. It's essentially a safety net for those who can't afford health care. Eligibility for Medicaid is based on strict income and asset limits, which vary by state. So, while Medicare is about age/disability, Medicaid is about financial need. You might qualify for Medicaid if your income falls below a certain threshold, even if you're younger than 65. Understanding Medicare versus Medicaid eligibility means recognizing that one is age-based, the other income-based. This distinction is vital for turning 65 Medicare planning. Now let's address the financial aspect and how these programs can, in some cases, work together. While Medicare is not income-based, for individuals with low incomes and limited resources, Medicaid can actually help pay for Medicare costs. These are often referred to as Medicare Savings Programs, MSPs. If you qualify for both Medicare and Medicaid, you are considered dual eligible. In this scenario, Medicaid can cover your Medicare Part A and Part B premiums, deductibles, co-payments, and co-insurance. This is a game changer for many seniors struggling with healthcare costs. So, it's not always an either/or situation. Sometimes it's a both, and where Medicaid acts as a crucial financial safety net for your Medicare. This is why knowing about Medicare benefits for seniors and Medicaid financial assistance is so important. Don't assume you don't qualify for assistance just because you have Medicare. Explore the possibilities of Medicare savings programs. Many individuals who are looking into Medicare at 65 also need to understand these income-based assistance programs. Now, before we continue to demystify even more of Medicare's complexities, if you're finding this information truly helpful, please take a moment to subscribe to Medicare 65 Made Easy right now. By subscribing, you'll ensure you don't miss out on more essential, easy-to-understand Medicare insights that can save you time, money, and headaches. Finally, let's tackle the fear of inadequate coverage and provider acceptance. When you have Original Medicare, Part A and Part B, you can see any doctor, hospital, or provider in the U.S. that accepts Medicare. This offers a wide network of choice. If you're dual eligible, meaning you have both Medicare and Medicaid, your Medicaid coverage will essentially fill in the gaps that Medicare doesn't cover, significantly reducing your out-of-pocket costs. This means your Medicare Part A and Medicare Part B benefits are supplemented by your Medicaid coverage. Doctors and hospitals that accept Medicare will generally accept patients who are dual eligible, as Medicaid becomes the secondary payer. For those considering Medicare Advantage plans, these are private plans that contract with Medicare to provide your Part A and Part B benefits. Some Medicare Advantage plans are specifically designed for dual eligible individuals, offering extra benefits and often having zero premiums. These plans can simplify your coverage by combining everything into one plan. The key is to verify if your preferred doctors accept the specific Medicare Advantage plan you're considering, or if they accept Original Medicare, if that's your choice. Don't let the fear of being uninsured or having limited access deter you. Understanding the complementary roles of Medicare and Medicaid can ensure comprehensive coverage for senior healthcare. At Medicare 65 Made Easy, our sole mission is to cut through the jargon and simplify Medicare for you. We understand that this is a critical time in your life, and accurate, up-to-date information is not just helpful, it's essential. We are committed to providing clear, concise, and actionable insights, ensuring you feel confident and in control of your healthcare decisions as you navigate Medicare turning 65. We consistently research the latest policy changes and enrollment rules, so you don't have to. Think of us as your trusted guide, here to illuminate the often confusing world of Medicare, helping you avoid costly mistakes and secure the best possible coverage for your needs. We are here to make your Medicare enrollment easy. Now that you understand the key differences between Medicare and Medicaid and how they can impact your healthcare journey as you turn 65, I've got something incredibly valuable specifically for you. For a limited time, I'm offering a free copy of my PDF printable 2025 Medicare Turning 65 checklist, your ultimate step-by-step guide to navigating this crucial milestone with complete confidence and clarity. To get your free checklist, simply head down to the description section right now and click on the link I've provided. It's designed to make your Medicare journey incredibly easy, just like our channel name, at Medicare 65 Made Easy promises. So remember, Medicare is generally age/disability based, while Medicaid is income based, and they can sometimes work together to your benefit. Arm yourself with this knowledge, and your